Hi, it's Dr. Noel Williams, Optimal Health Associates, coming to you from Crested Butte this weekend. Happy Labor Day. It's September 4th, 2021. The latest COVID updates are we continue to have lots of cases in Oklahoma. There are 95% Delta. The hospitals are very, very full. There was limited to no ICU beds multiple times over the last week. There's been some confusion about this, unfortunately, at the state level, but they're working on that with the hospital systems. I would really encourage everyone who's not vaccinated to get vaccinated. I know a lot of people who watch this are not for vaccination. A lot of people are. I just want to point out, as always, that if you're an adult, there's a 5,000% reduction in morbidity and mortality from Delta, even with the vaccine. When it was not Delta, it was higher. I don't talk a lot about masks anymore because I think there's a lot of controversy about masks, and I think the best data that I found is that they limit this droplet spread when someone has the disease, and so it will then cause less spreading over an initial period of time if you're in the room with someone who has COVID. So that's their main purpose. So that's why I think masks still have a role inside, and masks can still have a role in school systems and in other places. I do not feel very strongly about it. I want to be very clear, but there is a scientific basis for masking inside. I don't think there's a scientific basis for masking outside. Period. I think that's been well established for a while, but no one wants to hear that, so I'll not talk about it. I'm sorry if this causes people consternation, but the science is the science. I did a massive literature search on this last week. So much of what we do is performative and not really helpful. The number one helpful thing is getting the vaccine. Vaccine saves lives. Number two, take your vitamins, take your supplements like I've described. That is going to ameliorate the chances of a more vigorous negative infectious event, whether it's COVID or colds or flu, because if your immune system is bolstered and you're in a good nutritional status, you do better. Boosters. So the FDA's two lead people on the booster program resigned. They resigned last week or on Monday. It illustrates what I've been talking about. There is no science to the booster unless you're immunocompromised. Rushing the booster out without any scientific data shows it's performative. Who needs a booster? You need a booster if you were on chemotherapy while you got your vaccine, if you're continuing to be on chemotherapy. And this chemotherapy means biologics for rheumatoid arthritis or ankylosing spondylitis or any of the rheumatologic diseases, or if you're a cancer patient who is getting radiotherapy or chemotherapy, you need to know where your immune system is, and I would always encourage people to get their antibody levels checked. If you look at the Israeli data, again, the Israeli data with Delta shows the following. You're highly likely to get infected if you're not vaccinated. You are likely, probably somewhere in the range of 60% of the time, to get infected if you've been vaccinated, but the difference is half the time you're asymptomatic, half the time you have a very mild event. Less than 1% of the time you have something significant. Prior infected people who aren't vaccinated have 1/6 the infection rate with Delta. This continuing debate that you don't get immune response from having an infection is, I just have to say at this point, is idiotic. That's how we beat viruses. If we didn't have an immune response, they would kill us every time. Does that make sense to everyone? If you get a virus and it doesn't kill you, the reason is ultimately because your immune system brought it under control. So you then have sustained immunity from it. Now, do we know, is it years? No, we don't know that yet, but the trend is it's going to be for a long time. When I look at antibody levels of people who've been vaccinated or infected, they're very similar, and it can go either way, which I'm mumbling, but because I don't want to say anything because it's anecdotal, but there is a definite trend that there's very, very high antibodies in the infected. There's a trend in very, very high antibodies in vaccinated. So, but the thing is, it's always about your germ cells and in your thymic gland and your bone marrow. So that also gets to your thymus. If you've had your thymic gland taken out because you had a history of lymphoma or non-Hodgkin's lymphoma, you're going to need a booster. If you have anything significantly wrong with your thymic function, you need a booster. So think bone marrow for B cells, which make your antibodies. Think thymic gland, which is right through here. T cells, the T for thymic, T cell immunity. So if you have problems in those two areas, you need the booster. But that's all I can say about that. I'm trying to think what else. I guess the Tulane OU game's going on right now. For those of you watching it, I have no idea because I'm in Colorado, and so I have been outside. So that's it. Anything else, Kim? Am I missing anything? I just want everyone to be safe. I want you to take your fish oil. I want you to take your vitamin D. I want you to take your zinc at least a few times a week. I want you on your vitamin C. I'm not going to talk really much about ivermectin. We've kind of beat that into the ground scientifically, and I think more importantly that no, any licensed physician, and I'll do a post on this because this will be easy, a written post in the next few days, showing ivermectin in the physician's desk reference as a approved drug for physicians to use, just like Plaquenil. So that's where we're at with that. So that's it, just kind of a little snippet. Hang in there, be safe, wash your hands. Bye.